Okay, this is a long overdue hip series that I owe to a lot of my friends. I'm sorry, thank you for the wait. I'm gonna show you how to open up your hip flexors in the front, and then your quadratus lumborum and your piriformis in the back. So this is a great series, really for anybody, especially for runners, especially for people who are sitting for work all the time. A lot of low back pain actually comes from the hip flexors. Your hip flexor is a muscle that attaches on your pelvis and then your low back in your spine. So oftentimes people will have low back pain, but really it's coming from a muscle that you need to release through the front. And so we're gonna start by releasing the iliopsoas in 2 places in the front, and then we'll switch over to the back. So we're gonna start with the top portion of the iliopsoas. So basically between your ribs and your hip bone, you're gonna start right below your ribs in the soft tissue, but still above your hip bone. Mine's right here, okay? So for this one, lay on your stomach, press the ball into that spot that's tight, and then roll onto your stomach, and you're kind of bring this leg up into a tree frog position and extend over the ball. And you can roll either up or down until you find that spot that's sore. And when you get to a sore spot, then just relax your head down and take a few deep breaths over this spot for it to release. And I'll show you from the opposite side too. If I was getting the left, I'm here, place it under the left. Your leg is straight out back behind you, and then you bring the opposite leg up to the side. Another way you can intensify this, if you're doing this on your bed at home or on the couch, you can bring your leg off to the side, and then you can also press up. That's going to intensify it. If starting down here is painful, you're good, just stay right there. If you're here and you're like, I'm not feeling anything, bring your foot off to the side or come up and then press up, okay? All right, next is you're now going to move it to the lower portion. So iliopsoas is 2 muscles, the iliacus and the psoas muscle. So, or iliopsoas and the iliacus muscle. Don't listen to me for the anatomy. So now we're gonna go to the iliacus muscle. So that muscle, you find your hip bone, okay, find your hip bone, and then go slightly into the middle. Press the ball there, and again, you can go a little farther down or up. It's where it's tight on you. It's gonna be different for everybody. So you're gonna find that position, roll on top of it, and again, tree frog up with your other leg to stay on it. Intensify, back bend, or let that foot fall off, okay? Demonstrating on the other side. Hip bone, just below and inside your hip bone. Roll back onto it. Tree frog with your other leg. Too far off the table. And relax here. Press up to intensify. Okay? All right. Now, switching to your back, we're going to start with QL. So, my SI joint is right here. My bottom rib is right here. Press the ball in the middle of them. Okay, first extend your opposite leg down, and then let your ball side leg fall out to the side. A couple ways you can modify this. If your low back is feeling strained, start down here and just tilt your toes out to the side. If that's good, stop there. If you need a little more, bend your knees slightly, then let it fall out to the side. If you're not feeling anything there, come all the way up and then let your knee fall out. Your hips ideally will be symmetrical. If you're tight, one might get pulled up or crooked, but the end goal is that your hips will be level and symmetrical. Relax it here. When you're bringing your knee back up, tighten your low abs. Suck your belly button into your spine, and then bring your knee up. If it's out here and you just bring it up, you might end up straining your back more. So tighten your low abs, bring your knee back up, roll off, and take the ball out. the opposite side. It's not gonna be as easy for you to see the ball placement, but just so you get the idea on both sides. Okay? Extend the right leg out. This side's tighter for me. Let your left leg fall over to the side. So you'll see that my hips aren't as symmetrical on this side, and it's more painful. But I'm gonna stay here because my back doesn't feel strained. It feels like a good stretch. And then when I wanna bring my knee back up, suck my belly button into my spine, bring my knee back up to the top, okay? One more, piriformis. Your piriformis is a muscle that comes in at a diagonal below your glute max. So like your biggest glute muscle, your biggest butt muscle, has a little muscle, the piriformis, that cuts underneath then. You may have heard of it. Sometimes the sciatic nerve runs behind it. So if it's irritated, it can be a cause for people's sciatica. Just one of the many causes of sciatica, but that might have been where you've heard about it. But it's an annoying little muscle that can get pretty tight. And it's kind of on the outside portion of your glutes. So it's going to be the same positioning as your quadratus lumborum in your low back, but this time you just place the ball, glutes, on your back, roll up. You're here. Let that opposite leg go back down straight, and then let this knee fall over to the side. You can slide it down a little closer to your hamstrings and a little more out to the outside if you're not feeling anything. So usually you get kind of an angle here, so come out to that side. Same thing when you're coming back to center, you don't want to strain your low back. So tighten up your abs and come back up to center. To demonstrate on the other side, again, roll over, place the ball, extend the opposite, and then come down. Tighten your low abs, bring your knee back up. Okay. Any questions? Text me.